In this video, we listen to Chair of POTS UK and retired GP Dr Leslie Cavey talk with Dr Boon Lim about posture and postural counter manoeuvres.
I just want to now extend a conversation to talk about posture. So patients with POTS, the P in POTS stands for postural. How would you advise them about changing posture? What can they do before they stand up to make the symptoms better tolerated?
So people who have symptoms immediately on standing up, sometimes doing little exercises with their muscles can be helpful to boost your blood pressure before you stand up. And that might involve doing things like folding your arms really tight or pumping your fists. Have you got any other suggestions, Boo?
I'd say squeezing your butt, squeezing your quads and your calves, because that's where blood is pooling. And so I'm squeezing my butt now. You might not know, but I'm bouncing up and down the chair, and I can do this freely without you necessarily or people being conscious about what I'm doing. But I think the isometric exercises, and imagine there's a tube of a blood vessel surrounded by muscles. You're using your muscles to tighten around that tube to squeeze the blood from the tubes into your upper section, your heart and your brain, to fill that back with blood. Can be very powerful. The one thing I would say is people in the gym doing squats or tying a shoelace or doing gardening, that is a prime risky maneuver. Not whilst you're squatting, which generally feels quite good, but when you're standing up after a squat, especially if you're doing gardening and you've been down there for, say, a minute. And the trick there is actually to squeeze all the way up and not to let go of that squeeze for the duration of 5 or 10 seconds until you start mobilizing or walking. Don't just stand up and stay standing. So stand up, squeeze, start walking, and then release the squeeze. That would be my advice, because that's the prime time where you can activate your autonomic nervous system. Yeah.
Also, just to add to that, patients often find that standing in queues, for example, in supermarkets or to get into the cinema, is very, very challenging. And you can use these same sorts of manoeuvres to relieve your POTS symptoms or prevent fainting if you're prone to that. And again, that can involve things like squeezing your buttocks or crossing your legs and squeezing them together. Again, folding your arms, making or pumping a fist. All these things will help. But if you still feel really very symptomatic, sometimes the only thing you can do is get down, and squatting down can be very helpful initially if you don't really want to lie down flat. But as Boon said, standing up again will almost certainly trigger your symptoms afterwards, and you have to do that as described. But if you're very, very symptomatic, sometimes the only thing you can do is lie down on the floor and put your legs up on the air. And if you're really more symptomatic than that, ride a bicycle with your legs in the air, and that should help to prevent you fainting.
Yeah, I would always say to patients that if you're very embarrassed about doing that, it's still going to be less embarrassing than waking up with paramedics attending to your bloody nose when you've fallen on your face. So please don't feel embarrassed. If you have symptoms and you're at risk of falling, please lie down and elevate your feet. So I often find that even if patients are working from home on their kind of computer, on a Zoom or Teams meeting, even being seated can sometimes trigger symptoms, especially if you're seated with a man spread. So I would always recommend that you sit down and have some kind of tension in your legs. The easiest tension is to cross your legs, because when you're crossing your legs, you're putting tension on your front leg with the back leg. So imagine your knees of your back leg pressing against the calves of your front leg. The pressure is going to push the blood from your calf up. Even better if you sit down, cross your legs, and point your toes towards the ceiling. And if you can do that now, feel what it feels like. Your calf should tighten up. And then the other trick is you take a short stool like you would for a young boy who's learning how to pee, and you put it underneath your seat. And so you can step on the stool intermittently if you don't feel like crossing your legs. And that intermittent stepping motion whilst you're having a Zoom meeting will help to pump your lower limbs. And you were suggesting earlier on, even having a little pedal machine underneath your desk can be very helpful. So these are some of the ways that you can continue to work effectively from home or behind a screen while seated for a long time.
In addition to that, if you're, for example, working from home with a laptop, if you were to either sit on your bed or to sit in on a sofa with your feet up, then that can be quite helpful as well.
Okay, that's good.
In summary, remember posture is so important and there is lots you can do to help yourself when moving from position to position or when feeling symptomatic. Our top tips include folding your arms tightly, pumping your fists and squeezing your buttocks. For some, standing in queues can be challenging. These same sort of manoeuvres would be helpful. Crossing your legs together and squeezing them tightly. If still symptomatic, squatting down or lying may be the only option. Please try not to be embarrassed. We appreciate this is far easier said than done, but much better to sit down by choice than to fall. We know for many people that even being seated can trigger symptoms. Some top tips are to keep tension in your legs. The easiest way to do this is by crossing your legs and pointing your toes towards the ceiling. Another option is to have a low stool under your feet or a pedal machine that you can use to keep your legs active while seated for a long time. Lots of people report that sitting on their bed or sofa with their feet up can be helpful. We hope you have found this video helpful. Please remember that there is lots more information available on the POTS UK website. Please visit www.potsuk.org.